Good afternoon, everyone. My name is Ray Cornelio. I'm a solutions architect here at MTX, and I'd like to thank you for taking the time out of your day to join our webinar as we speak about taking a deeper dive into technology related to the 988 crisis response centers being stood up across the United States. Next slide. So for today's agenda, we're going to go over a brief overview of MTX, and we'll conduct brief introductions to our team members that are on, our family members that are on the call today, as well as an overview of our 90-day crisis safe response system. And then we'll go straight into the panel discussion, and we'll open it up for questions and answer section. If you do have any questions or they come to mind during the webinar, please feel free to go ahead and enter them into the chat window. We have somebody monitoring the window, and we'll be able to address those during the Q&A section. Next slide. So a little bit about MTX. We are a global technology consulting firm, and over 87% of our focus is in modernizing technology for public sector agencies. What sets us apart from most other companies is our speed to market. We're in over 30 states, and we have about 1,350 family members. We also have vertical teams that are full of subject matter experts in a variety of business verticals, healthcare, human services, transportation, just to name a few. Next slide. And here in front of us, we have just a few of the many clients that we keep in the public sector. So as you can see, we have NYPD, we have Vermont, and a variety of other clients that we've helped with everything from doing COVID work to disease surveillance, and now with the 988. Next. Next slide. Thank you. So my name is Ray Cornelio. I originally started my healthcare career in behavioral health. I was a cognitive neuroscientist by trade, switched over to the administrative side, and I've helped administer hospitals and health systems, behavioral health networks, and primary care networks for the last 13 years. With that, I'll pass it off, Abe.
Thank you, Ray. Appreciate that. I'm Abe Balsamo. I'm the medical director at MTX. I've got about 15 years doing mental health and emergency medicine. I was trained at the University of New Mexico as well as University of Nebraska medical schools. Lots of experience and lots of passion here. It's our biggest chance to make some real changes to the mental health systems. I'll turn it over to Abhishek.
Thank you, Abe. Thank you, Ray. So, hi everyone. This is Abhishek Jivankar. I'm one of the product managers in MTX who has worked on the 988 contact center build. I've been working in MTX for the past 8 months. Before that, I've had 15 years of experience in IT industry. During this time, I have had a chance to work on various healthcare and healthcare insurance solutions. But if I'm being totally honest, all the solutions that I've worked on in the past, I must say 988 contact center has the largest potential to make the difference for the betterment of community health. And this is why I'm most excited to be part of this group. I would hand it over to Aparajita.
Hi everybody, I'm Aparajita Fadke. I'm a product manager here at MTX, and I have been working on healthcare products for the past 2 years now, and I feel really great to have gotten this opportunity to work on 988 product, especially because this is something that is so impactful and meaningful for the society. Thank you.
Thank you. So now that we've met the team, I'd like to go ahead and just do a kind of a brief introduction to our system, our 988 Crisis Safe Response system. With the new Crisis Now model, really the focus on 988 has been getting a person in crisis, someone to talk to, someone to respond, and a place to go. And I think in the slides that we're going to cover next, we'll speak to all of these. Thank you. We'll speak to all of this. In considering everything that has to happen when a person is in crisis, we really wanted to be able to create a system and showcase a system that is just one overall solution that is able to be easily integrated with the variety of systems that exist within the healthcare world, within the EMS world, within the 911 world. So when we set out to build this solution, that's exactly what we wanted to do. So everything here starts from the 988 call center perspective. On the screen that we have in front of us, you see a basic caller intake screen where they fill out information about the caller, their name, their location of the incident, insurance provider information, their member ID, as well as special population identifiers, the person that's calling a veteran, are they part of the LGBT community, are they a Native American, as well as kind of referral options that they have. Then on the bottom of the screens, you see the ability for the call center agent to do interventions and assessment. So we have a variety of preloaded assessments into the system. Our mental health assessment is a PHQ-9. We have a substance abuse assessment. We have a social needs assessment. That's the baseline from CMS. And then the other assessments like the substance abuse one and domestic violence also come from DSM-5 and a variety of other industry standards. To the right of this, on the right-hand side column, we have the ability to dispatch a mobile crisis team, the ability to do bed registry and to schedule appointments, as well as a section for us to enter clinical information and notes during the call. Next slide, please. Here we have an example of, say we have somebody, a person that's in crisis, or the mobile crisis team is on the scene with somebody. We have the ability to go ahead here and see the available beds within a given geographic area. Simply, they would select the facility type, and from that drop-down menu, we have hospitals, we have stabilization centers, we have shelters, a variety of different assets within the community that could be inputted into the system and then selected. You can go to the next screen. Once you go ahead and select the facility type, this bed registration or the available bed registration screen would pop up, and not only will you receive information about the facility or the provider, like the name of the facility, the types, the names of the providers that are available or on shift that day, but it tells you what type of care they're giving, their average length of stay. It gives you a lot of information that's related to the facility, as well as the bed registration information that you're conducting. And it confirms in the next section below the consumer information or the caller information before you go ahead and register them for a bed at that facility. Next screen, please. Here we have an example of a call center agent dispatching a mobile crisis unit. And if you take a look at the screen, you'll see the duration of the response time to dispatch, so how long it took for us to actually dispatch the call, the estimated transit time from where the current mobile crisis unit team member is to where the person in crisis is, as well as, again, the consumer information. It lets us know who was calling, the location of their incident, their insurance information, and any special notes on the bottom where there's safety concerns. For example, if they had a gun on the scene or a knife on the scene, we'd have the ability to notate that there and also communicate that information to emergency responders. Next slide. Here we're showcasing the abilities for us to do appointment and referrals. In this example, we're just showing the outpatient scheduling capacity. We start by inputting the date. It would default to today's date. Then we select the outpatient scheduling facility. In this instance, we have a mental health center, the Mercy Mental Health Center, and it shows us the available times. And next screen. On this following screen, very similar to our screen for bed registry, it has all the information about the facility, the appointment related information, and the consumer. Next screen. And as always, dashboards and insights and analytics are going to be at the center of everything that the state is doing, as well as reporting for the use of their funds, if they're using block grants, if we're using Medicaid for reimbursement, just a variety of metrics that are all customizable and configurable to whatever's top of mind for the state. Here we just have just a few normal call center metrics, resolution rates, average call time, and as well as the disposition of certain call statuses. And this nice graphic that we're displaying here is really just identifying hotspots within a given area to say if we needed to staff additional mobile crisis units in a certain city or in a certain district or in a certain precinct, we'd be able to have that capability as well to actually showcase it. Next slide.
And Ray, if I could jump in, I wanted to point out that our system is fully integrated. It's already built. And what you're seeing today is not necessarily our secret sauce. We love to invite people, stakeholders, to a full demo to show off the end-to-end system. Just so everybody knows, that last slide was more representative of our system. It's very smooth. It's awesome. Abhishek and Aparajita really put it together well with their teams.
Definitely, thank you, Abe. Yes. We will be reaching out to everybody after the webinar, and in the email you will receive a link to register and schedule for a demo, as well as towards the end of this presentation, we'd also give you the website information as to where you can go to the website and register for a demo as well. All right, next screen. So we're going to go ahead and kick off the discussion now. So, Parajita, what are some of the features of 988 system states may not be thinking about?
Well, there are so many that 1 hour wouldn't cover it, but I'll try and keep it brief. So to start with, our 988 product is one unified platform for call center, crisis units, and the providers. And the information flows uninterruptedly from call center system to the crisis mobile app and the provider portal. I would like to talk about a few distinguished features that we have developed. To start with, our AI sentiment analysis, which help agent assess the situation better, navigate the conversation, and make immediate decisions if required by assessing the moods and emotions of the caller. Another important feature that we've built is the ability for the call center agents to be able to track the live locations of the available and the occupied crisis units on the map, and being able to dispatch the available units on just a click of a button. When that's done, we tie it very seamlessly with the mobile application, where the crisis units receive the dispatch request immediately, and they are able to view and navigate to the location of the person in distress. Now, you know, every emergency situation, every minute is very important. So we have built this seamless communication channel between all these three systems. So call center agent, mobile application, and provider portal will have a chatter functionality where they will be able to exchange information and help out in case of emergency and otherwise. Last but not the least, I would like to talk about our social media monitoring functionality. With people living every minute of their lives on Instagram, Twitter, and Facebook, it gives us an opportunity to stymie the problem before it becomes an emergency. So our advanced analysis determines what their choices of words reveal and create a prediction analysis. This could prove as a very powerful tool to diagnose an arising situation early.
Thank you, Parajita. I could definitely see how, approaching this from a unified platform perspective and using tools like AI sentiment analysis and social media monitoring could definitely help not only the person that's in crisis with that episode of care, but really across, the lifetime of providing that person care. So not only just getting them to a specific bed in time with knowing where the mobile crisis units are, but also being able to do the follow-up monitoring and scheduling follow-up visits and appointments as well. So Abhishek, what do you think are some of the features that states aren't thinking about?
Yeah, on the same lines as Aparajita, but the way I'm just wanted to put it is like the one way to imagine is that the 988 system is not just a call center, it's actually a one-stop for mental wellness. And if we are thinking that our scope is suicide prevention, that prevention scope doesn't have to start when someone actually has a knife in their hand. We can start that prevention much earlier. As Aparajita mentioned, we have an ability to identify someone who's going through a challenging times or depression through their through multiple factors. But on top of this, the system has an ability to provide care to these individuals. So it can be done by integrating the 988 system with the mental health providers, which would allow someone to book an appointment or book an appointment for mental or behavioral health systems. We want people to think of 988 even if they are not in an active emergency situations. So virtual assistants can be a very helpful functionality for these non-emergency scenarios. Similarly, we need an ability to provide continued care to someone after they have gone through an episode when they were considering self-harm. So this is where the integration with the providers to fetch the bed details or the services details are that are available in the area. This would allow 988 call center to refer someone to a facility. Telemedicine is another good functionality that can help us get the same results, continued care. And one more functionality that I wanted to mention is not just care, but a long-term support for someone who's either going through, which can be provided through social services or rehabilitation services. So the system has the ability to identify someone who is facing substance abuse or facing homelessness or is going through some domestic violence or another abuse related situations. And system has an ability to generate referrals to social services, homeless centers, drug rehabilitation centers, and provide a continuation of care and support to these individuals.
Right. Hey, Abhishek, thank you for that. I wanted to jump in because there's always that question of why are we doing it as one integrated system? And I think really the answer is efficiencies. We need to be efficient. We need to respond in real time. We know the system as it is now is pretty broken. We respond to 911 calls for mental health sometimes way too slow. You know, things have already happened. This kind of a system will get everybody on the same page. Also, it helps with staffing. Our system, one of the things that you guys have built in, which is, I think, fantastic, is a virtual assistant to be able to reroute low acuity calls when, you know, and I always go back to the little old lady who's at home alone, sad, wants to call. She may not be suicidal at the moment, and when the call center answers, they may be able to get her resources through the kind of offloading the call center a little bit. Again, providing more efficiencies to do the harm reduction long term, if you will. We know that the system, if it's built right, which we feel ours is, will save the society literally billions of dollars, and that comes from the Federal Register. This isn't my numbers. You know, the investment in this system is something that I think is really, really important for the society in general. Also, doing it right, you keep people out of jail, you keep people out of bounce backs to ERs and urgent cares, and you really provide a better standard of life. And you touched a little bit on what happens afterwards, the referrals and that kind of thing. Our system is very much built with the patient in mind, and it's built by our subject matter experts first. And the reason we did that was really because we wanted to make sure we follow the journey of this client, this patient, long term. So not only in the acute phase, but in the chronic phase, that they don't relapse back into that same kind of way of thinking. They stay on their medications. They're able to make their appointments. They have reminders, etc. This is all kind of built in. So just kind of wanted to touch on that from more from the business side, the why we're doing it the way we are.
No, definitely. Thank you, Abe. And the more we talk about this and the more we see how technology can help really alleviate some of the problems with a person in crisis when it's related to mental health. It reminds me of just a quick story that when I was helping run primary care clinics, we had a lot of the older population that would come in just to talk to somebody, just to visit. And I think taking a proactive approach or having a system that is proactive versus reactive is revolutionary. So moving on to our next question. Next slide, please. How can technology be leveraged to keep everyone informed in a single system? And what are the benefits of having a completely integrated system, Abe?
So I think, again, we touch on that patient-centered model where we get the patient, the client, the care they need in real time, but also we follow them throughout their journey. This isn't a one time, one stop, and then you're done, which is kind of the model that medicine has right now. You may see your PCP and they come up with a plan, but they don't know if you executed your plan. In this system, we put the patient in the middle with the call center initially, and then there's a warm handoff to a case manager so that you make sure you get all the things you need in real time. There's real communication, and Abhishek, you touched on this, real communication with everybody. 911 knows what's happening in real time. The bed registries know what's happening. When somebody gets discharged from a facility, we get pinged back to our system so case management can kick in, make sure they follow up on their the things that are going to make their life better, because ultimately we want to provide outcomes. We want to make big changes to the systems, and this is one way that we've been able to do it. It keeps the patient engaged in real time, and again, it decreases those bounce backs and the real cost to society. We know that housing an inmate at a county jail is about $100 a day. Compound that towards all of the people, and I work in corrections. 80% of the people in my correctional facility have some kind of mental health diagnosis. And so if you think about, if we could offload the system, we're going to be saving the society a lot of money. So, again, it goes back to that why. Why should we do it? And I think it just is the right model for mental health.
Absolutely. And Parajita, what are your thoughts?
Well, what Abe mentioned, I completely agree. And the kind of integration that we have with, very important emergency systems like 911, we have an inbuilt ability for a warm handoff to 911. So the preliminary information, if collected on the 988 site, will be transferred to 911 immediately when the handoff is done to the 911 responders. And so the 911 responders wouldn't have to go through the same intake or the same assessment, and the time is cut short, and there is no redundancies. So this will reduce the turnaround time of a crisis situation, and this integration between two emergency systems will really prove vital in tackling an emergency situation, is what I feel.
Definitely.
Also,
I think oh, sorry, go ahead.
no, I just remembered one point that Abhishek had previously mentioned, is when we are talking about integration and between this 988 system, one very important point is the bed availability information that is coming to the crisis responders. The crisis responders are able to look at the type of beds and the number of beds that are available at the nearest facility, nearest to the person in crisis, so that they can take the person there, and they wouldn't have to search. If the bed is not available, you don't go to the nearest facility, you go to the second nearest facility, depending upon the bed required.
Absolutely. And definitely in a crisis, communication is key. I think having taken the approach that we've taken to build this system, being able to do an intake, do an assessment, schedule appointments, do referrals, and then communicate that information to everybody involved in that episode of care or in the continuum of care is really going to help, and it's going to show going to prove that there's multiple ways to approach the mental health crisis. And then next question, please. So Abe, what role do you see 988 playing, platforms playing in the development of wraparound services? So we keep talking about how great this is and what a revolution this is in the mental health space, but it doesn't just end there. I think right now what's broken with our system, it's almost like a sick care model. We're always being reactive as opposed to proactive. So how would this platform really help with creating something that is proactive and then following up, which is also, a difficult thing to do now, given caseloads, given just the lack of communication between providers and patients and caregivers as well.
Right. No, it's a good question. And I think really it goes back to once somebody is out of their acute phase, you continue to follow them in the same system. You're able to do that care coordination, and that's where it's kind of backwards a little bit to what you're saying, because yes, we capture them when they have an acute need, and I say capture, but that's when they hit the system first, and there's no wrong door, as we know. But if they hit the system when there's an acute need, we circle back at the end. Once they're stabilized, we know they're stabilized, and now we can get them the care coordination they need to keep them out of the system long term, to really do right by the patient ultimately. And there's bits and pieces. The status quo is just not good enough. We haven't done a good job nationally and probably around the world with mental health. Nobody has wanted to tackle it, and this is a big opportunity right now. One of the things that we have decided is we need to do it different. And I think we all know that from the 988 perspective. And one of the things that we're doing different is you don't just get the call, dispatch a team, wait for the team to get there, which is kind of the model of 911. Obviously, with 988, we're dispatching a different team potentially. They're mental health providers. So that's number one. We may be doing a kind of group response with mental health providers and police officers or fire or EMS or whoever needs to be a part of that team. But one of the big differentiators that I think is going to make a big difference is you also have this telemedicine component. Because if I dispatch somebody, there's a difference between keeping the person on the phone and actually seeing them and doing telemedicine for 15, 20 minutes while your crisis team gets there. You can get them to a provider right now, at the moment, somebody who's very specialized, PhD, MD, DO, anywhere along that spectrum, who can potentially talk them down right now, and use their clinical judgment to make some really big decisions also in real time. So I think that's also something that sets it apart. Now, Ray, you also touched on social services. This community, people with mental health disorders, they have a hard time accessing the things that they need. They may have a need for, TANF, SNAP, some other social services, housing. This is the time where, again, we kind of, and I'm going to use the word capture, we capture these people, and then we can coordinate not only their care medically and their care physically, but we can coordinate their social needs. We can get them food, get them somebody to check on them and fill their pill boxes, do all of these things that really are important to get the patient a real outcome, not just hey, I checked the box, I did my thing, I'm going to get paid. We're doing real outcomes here in this system, and that's what I think also is really important. And if we do it right across the nation, it's going to be huge.
And to add to Abe's point, I think in the designing of our system, being able to assign care teams and knowing who's involved in that process or that episode of care. So if we have a caller that's called in that has a history of mental illness, and mobile crisis teams have been deployed multiple times to their location, notifying everybody that's involved in that episode of care and his care continuum, letting the caretaker know that this is what's going on with John Doe, and letting them know these are the appointments that they have available. Just keeping that constant communication, I think is key. And then involving that with social services and other wraparound services also to let them know, because they're continuously performing their own intake assessments and they very rarely have information. as to what happened that caused that patient or that caller to go to their facility. Next slide, please. So we've kind of touched on this a little bit, but we haven't really delved deep into it. You know, how can the 988 technology or just technology in general be used to augment staff? And I'm gonna default that to Abhishek. Can you tell us a little bit of your thoughts on that?
Yeah, I mean, we can think of a few functionalities that we have added, or a few technologies that we have added to our solution to assist the call center agent or call center staffs. One of the first is an ability assisting them for the clinical decision making. So what we have loaded is that what we have done is that we have preloaded some peer-reviewed industry standard assessments in the system in the form of an assessment tools. So that is something that Ray, you just showed a preview earlier. So what these assessment tools do is that they generate a risk score for each caller. And some of the assessments are an assessment to identify the suicide severity rate, an assessment for substance abuse and drug addiction, an assessment for homelessness. What these tools help us is that they help call center agent objectively assess the risk rating for each of the caller. To further support that, we talked a little bit about the AI-powered sentiment analysis tool, and I'm going to speak through why this tool is one of the most important functionality is because this monitors the call transcript and the voice sentiment analysis and generates a score corresponding to the caller's current emotion state. So when you are in an active call, we expect that the call center agent would be able to refer to the score generated by the sentiment analysis tool and track that they have been able to reduce the risk rating of the call. They've been successfully able to calm down the person, and they can be 100% sure that the person is or the caller is calm before they disconnect the call. One more key functionality is virtual assistants. Now, I mean, every time we are mentioning virtual assistants, I feel like I always should mention that we are never routing any emergency call to virtual assistants, but we can see a lot of low acuity calls that can be taken up by virtual assistants. Somebody maybe just getting to 988 portal to get availability of providers or get details about the care that they had received. And the virtual assistants can really be virtual assistant can be a very powerful tool that can help us in that. And what that would do is it would make sure that the call center agents are able to focus on the real emergency scenarios. I don't know, Prajita, can you feel free to add more to this?
Yeah, absolutely. I mean, our entire system is built keeping the user experience in mind, built with the aim of making the user's life easier, the entire process efficient. So I can think of a few more functionalities that we've already built, one of which is the live monitoring functionality, which gives an ability for the supervisors to listen into the ongoing calls for monitoring how the calls are being handled and how the situation is being routed through different channels. Another thing is something called as whisper functionality, which is a two-way live chat between agents. So without the caller being being able to see or understand, I as an agent will be able to chat with another agent or my supervisor and seek help. So this will cut down a lot of ticket raising or mailing through some tools, or all that time that goes into the processes. And the supervisor can also, monitor the performance through live chat. When we are talking about augmenting staff, I think one tool that we've talked about is the social media monitoring, and how it will be helpful in assessing the mental well-being of the community. So we of course are not doing it at the individual level, but the system will present an overall trend analysis after considering several factors related to mental well-being and the factors affecting that trend, such as weather or economic downturn or sporting event or of such sort. So what this will do is this will generate a score, and this will help us predict a surge in the calls to 988 helpline. And therefore you can utilize this analysis to staff the call centers more effectively.
Awesome. And Abe, what
Awesome,
are your thoughts
Aparajita.
on how
I just wanted
technology can
Yeah, thanks, Ray. I wanted to jump in, and
Sorry.
I wanted to reemphasize, our system is a very guided process. The live monitoring functionality for supervisors allows for very streamlined communication. The decision augmentation with peer-reviewed assessment tools is very, very important. We want everybody to be on the same page and have real reasons to make a decision, because these are potentially life-saving or life-altering decisions that they're making in the call center. And finally, the AI sentiment analysis, I'm proud of our team for that. That is something they built ground up. Essentially, it's a filter that it's awesome. You run the voice through it. It provides a transcript. It checks on their speed of communication. It checks on keywords that may put somebody at risk, and then gives you this score, both not only as you run through the chat or the transcript, but also a global score for the whole call. Just really, really powerful. And all of these decision augmentation tools are very configurable, number one. So if you want a different peer-reviewed assessment tool, well, we just plug it in, no big deal. Right now, we have the PQH9 and some other very important tools built in. I think, Ray, you can correct me on this one, but I think we have 6 or 7 tools built in the base. But and that social media monitoring that Aparajita touched on, you can do that community-wide. We know some states do that just to kind of get a feel of what's going on in the community, and potentially we can do that at the individual. And I know Aparajita, you said we wouldn't do this, but if a patient opts in, then we can do it at the individual level, and have their care coordinator in a very provisioned way. Only they can see the information. But again, it's patient-centered. We really want the care coordinator and the patient to be on the same page at all times. And so as long as they opt in, we can provide that service also. So I just wanted to touch on that a little bit. Awesome, awesome features, guys.
Absolutely. And I think from a staff augmentation standpoint, having these kind of tools readily available at their disposal will really help not only process the normal workings of the organization, paperwork, doing social media monitoring is not something that you can even do right now. It's so difficult and so time consuming to actually look at all the other factors that are affecting the patient, or have predictive analytics to say it's Christmas time. We know that people get more depressed during that time. Having somebody dedicated to that, especially right now with staff shortages worldwide, trying to figure out how everyone's returning back to work with COVID. It's a difficult process. I also see how the clinical decision support tool and the virtual assistant could be revolutionary. Having them visit a website if it's low acuity, even do some self-assessments, and having the person, well, not in crisis at this point, but having the person do some of the assessments themselves and having that information communicated to their care teams, or if there is for some reason, if the chat with the virtual assistant turns more emergent, having the ability to get connected to a live agent or get connected with emergency services. Yeah, I think it's great. I think I'm super excited about this. We've been working on it for quite some time, and it's nice to see all of these things come into fruition. Next question, please. And this one is the one I'm most excited to speak about. What approach has MTX taken to design their system, and how does it differ from other solutions? So, Abe, if you can go ahead and kick that off.
Yeah. Yes, please. I think number one, it starts with subject matter expertise. We've got a lot of professionals from our vertical team, PhDs, MDs, DOs, licensed social workers, etc. And I say a lot of them. We have more than most companies, and they are driving this. They know what it takes on the ground. They have been there. They've lived this world. They know what's right and what's not right, what's easy and what's not easy. And so with the help of our subject matter experts, we've been able to iron out a lot of the big issues that we foresee coming. This is not really an MVP in technical speak. You know, this isn't the minimal viable product. This is a real product built for exactly this, not for anything else. And I think that sets us apart. Again, the future vision, we're already working on phase 2. You're hearing about phase 1 right now. We're building phase 2 already. That's something that I'm, again, proud of our team. We're thinking ahead. We know what's coming. The base has all the FCC guidelines, the SAMHSA guidelines, the top security concerns have been addressed. And so, from that standpoint, we check all the boxes, but our team is building something totally different. And you've heard about a lot of those bells and whistles. And so I'm going to turn it over to Abhishek a little more. We know you're not all going to need everything. And so I kind of hand it to him at this point.
Yeah. To what Abe was mentioning, it's a pre-built platform, but again, it's a purpose-built COT solution. It's not just a standard call center solution. It's a solution that we think will take care of 80% of the requirement of any standard 988 system, and then would allow us to finish up the remaining 20% and deploy the solution in the fastest possible time. And that is one of the approach that definitely sets us apart. It significantly reduces the time to value of the solution. And the second thing that I wanted to emphasize was, even though it's a unified system, it's built in a very modular fashion. So all the modules that we talked about, the call center intake, the sentiment analysis, assessment tools, dispatch, linkage to care, virtual assistants, social media monitoring, call set predictions, all of them can be added to your existing system, or can be used as an accelerator for your 988 implementation. And the way these modules have been prepared, they are able to integrate with not just 988 but also with a 911 solution. So you can take the dispatch component from 988, which allows us to dispatch mental health trained professionals as a part of mobile crisis units. You can integrate with your 911 integration system and then have a consolidated response, including fire, police, and 988 trained mobile crisis systems. And that is for the things that set us apart. Aparajita, feel free to add on to anything that I might have missed.
No, I think, Abe and Abhishek, you've covered most of it. I wouldn't take much time just talking about how is our system different from other solutions. Is we have driven the solution home by capping it with the case management system at the end of the flow. So we are addressing the calls, we are routing the emergency teams, we are referring to care facility, but what after that? After that, also our system supports case managers to be able to track the case monitor, and with the continuous follow-ups and conducting further assessments, and basically drafting a proper care plan for an individual, and creating additional service referrals if required, and making sure that the loop is closed at the end of it.
Absolutely. And just to kind of recap what everybody's saying, everyone said this system was designed by our subject matter experts, and we took a different approach to it. We focused on putting the patient or the caller at the center of the entire platform to really help develop tools like that clinical decision support tool, like those AI powered sentiment analysis. And then we wanted to create a system that it's easy to use. It's one platform that is able and capable of configuring with the variety of systems that are out there, from EHRs to emergency dispatch systems to mental health provider system, even some of their paper-based stuff, trying to figure out how we can really account for everything that's going on in the continuum of care when it comes to a mental health crisis. And most importantly, we're not talking about an MVP today. We're really talking about a system that is ready to go. It's designed, it's built. We showcased some screenshots from our earlier system when we were building this out, but we definitely have a fully baked solution that's ready to be demoed at any given time. And definitely, like it says on this slide, look out for an email from Abe, because he'll definitely be reaching out to you and providing that information to schedule a follow-up demo.
Thanks, Ray. And just to kind of finish up here, there was a couple questions from the audience about APIs, fire enablement, HL7. The honest truth is our system is fully integrated and fully integratable. So whatever requirements you have, we can pass the information back and forth between different systems. And we know everybody's going to have different systems. So you might have a 911 system that needs to communicate. EHRs, bed registries may or may not be built already. Certainly our system has all of that in it, but if you want to use the one you already have, that's no problem. And so wanted to just touch on that a little bit. And when we're collecting data, that data flows pretty seamlessly in a bi-directional way. But with provisioned access, we have to keep HIPAA in mind. We have to keep the regulations in mind for PII and PHI. And so those standards are very configurable at the state level, but we also follow national standards there. And then, finally, there was also a question about how is social media triggered and monitored. Again, that is something that can be triggered in the way that they want it. The community wants it. If there's an uptick of 10% in sentiment, in negative sentiment, you can get pinged. Okay, hey, mental health department, something's going on. Be aware of it. That kind of thing. But you can set those thresholds wherever you want. It could be 10%, 5%, 100%. Whatever you want those to be. And kind of the same thing with the individuals if they opt in. There's certain keywords that you may want. Every time they have a keyword, the case manager gets a note, and that's something that can be built in. But also, if they're trending down this path of it seems like things are going wrong, at some point we set a trigger, and that can be defined by the end users. So I just wanted to touch on those. Ultimately, Ray, I want to close up, and I want to invite our audience. Please reach out to us. We'd love to give you a full demo. I know Ray said it, and I'm going to say it again because I sit in all the demos. I'd love to see you. I really want to show you what Abhishek and Aparajita and their teams have built. You're going to be surprised at the fully functional system that is already there. And it's going to, if nothing else, give you ideas for the system that someone else builds. And I'm okay with that. Really, again, MTX and my team, we are all about outcomes. And if we can provide one outcome, we save one life, 2 lives, 3 lives. If you look at the stats, every life that we save is worth around $9 million. And that's in total. That's the cost to medical. That's the cost to Lifeline, lifetime earnings. That's the cost to a lot of things. But every life is worth about $9 million. So if I can save one life, I just paid for my system. And so, these are the things that I want to be able to talk to each one of you individually about. I want to show you our demo. I am very passionate about this, and my team has basically taken our vision as subject matter expertise or experts and we've run with it and we've invested. We talked our team into investing millions of dollars in this system. So really, it's time to show it off. So with that, Ray, I think I'm done talking.
Yeah, absolutely. Thank you, Abe. There's one final point that I did want to hit on, and it was regarding our modularized approach. So while the system is 100% configurable and we're able to pretty much play with any system that's out there, we have created the 98-day crisis safe response system in a way that it is modular. So if it's only mobile crisis units that need to be, that the state only wants mobile crisis units dispatch capabilities, we're able to account for that, or the case management aspect of it. It is a fully modularized approach.
Awesome, Ray. Thank you. And we recognize that there was a couple questions through Q&A that didn't get answered today, but we will answer them in the follow-up email.
Awesome. So I'd like to once again thank everyone for joining, and really appreciate taking the time out of your day to look at our 98-day crisis safe response platform and how we delve into how technology could really help a person in crisis, and a person experiencing a mental health crisis. Thank you.
Awesome. Thank you all.
Thank you everyone for joining.
Bye. Thanks, everyone.
Thanks, everybody.